Good morning, everyone. First, I'll take the attendance.
नहीं ऐसे नहीं है सर।
Oh, okay.
अटेंडेंस इसमें लिखा आएगा, मैं आपको बताऊंगा।
Okay, कैसे क्या करना
ठीक है,
बताइए।
यहाँ पे आएगा सर ये अटेंडेंस, ये आएंगे सर, ये सभी लोग लिखे हुए आएंगे।
कहाँ पे अभी कहाँ पे आ रहा है? कहाँ पे है लोग?
अभी सर जुड़े नहीं है ना ये लोग, ये सर जुड़ गए ना।
हाँ,
6 बच्चे आ गए सर।
छोड़ दीजिए।
ठीक है,
तो इनके नाम क्या क्या है, कैसे मालूम चलेगा?
अभी लास्ट में सर ना,
नहीं, शुरुआत में लूंगा, लास्ट का चक्कर नहीं मेरा।
लास्ट में चक्कर नहीं आपका। ठीक है सर, ये आ गया इनका रोल नंबर 3613।
3613। और दूसरा बताओ।
और सर 3613 के बाद 3525,
3525।
3540,
35
और जुड़ेंगे सर टाइम,
3525।
और 3540,
3540।
3574,
3574।
3597,
97।
3613।
3613 हो गया बस।
सर लास्ट में लगाएंगे, तो अभी
नहीं,
आ रहे जुड़ रहे हैं सर ये।
दैट्स नॉट माई रिस्पॉन्सिबिलिटी। 9 o'clock हो गया, चलिए, दैट्स इट।
ठीक है सर, ये 15 हो गए, 16।
जितने लग गया चलिए, मैं
चलिए
इनका थोड़ी करता रहूँगा, 10 बजे तक जुड़ते रहेंगे।
ठीक है सर, आप बोलो।
सो गुड मॉर्निंग एवरीवन,
हाँ
एंड
बस।
those who were present, I have marked the attendance, and then other people, they can join in, but I am not going to give attendance to anyone. It is 9:08 right now, so we will start, in fact 9:09. So let me start the lecture today. It's an important topic about the healthcare services for elderly. As you know, the ये इसका स्लाइड नहीं मूव हो रही है, क्या बात है?
नहीं हो रहा।
ये स्लाइड नहीं मूव हो रही है।
ठीक है सर, थोड़े पता जो है क्या क्या। ठीक है सर, आप हो जाएगा।
ठीक है, छोड़ दीजिए। So today I am going to discuss an important topic, and that is about the healthcare of elderly. As we know that the elderly population, it is on increase in India, and they have a different kind of issues, whether it is emotional issues, health issues, many degenerative diseases, and at times they don't have that much energy to go and seek medical care at different centers. So they have a different kind of issues. So there is a special need for healthcare of elderly, and that's why uh, today I am going to discuss. And I don't know if I can interact with you people, but if it is possible, I would definitely like to interact, so that it should be two-way communication rather than one-way communication. Aging, as you know, it is a unavoidable condition, and that is part of life cycle. Everyone, I mean, from infancy to adulthood to geriatric age group. So it is an unavoidable condition, and everybody has to go through this during life cycle. And what's happening that if you see in different countries, they have different percentage of geriatric population. Certain countries have very huge population. If you see the age pyramid, many of the developed country, they have huge population of geriatric age group, while their birth rate is low. But in a countries like India, though our birth rate and other things, they are getting better, but still we have the young population, which is huge in number, and the elderly population is not that much. But with the increase in life expectancy and better healthcare services, our geriatric population is at rise, and all these people, who are young now, in coming years, they would be in age group which is considered elderly. And at that time, it would be a big challenge to provide the services to these people. If you go by population size, then you can very well assume that even if little increase in the percentages of geriatric population, it would be huge in absolute number because of sheer size of population. The proportion which has increased, if you see 2001 census, it was 7.7%, 70 million people were there. In 2011 census, it was 8.14, and in 2021, I expect it to be somewhere 10% of. When we'll have the data of 2021, I expect it to be somewhere around 10%. India is in the demographic transition. We know that's what I was discussing. That right now we have young population a lot, but with the increasing life expectancy, the adult population is increasing. And what would be the prediction? I mean, what we assume is in 2021 probably there would be 133 million. So if you see from 70 million in 2001 to expected is 133 million, almost double. Then in 2031, 178 million, 236 million, and 300 million by 2051. So these are the projection, and by the time you all would become the doctor and would be serving the society, you will see the huge increase in the geriatric population. Like when I was studying, there was most of the focus was on the infants in the pediatric health, because at that time geriatric population was not that much and it was a kind of a neglected specialty. Nobody was talking about the geriatric problem separately. Everywhere it was the mother and child health services. But now because of these life expectancy, more and more emphasis is being given to geriatric health as well as non-communicable diseases. If you see in the most of the world, the sex ratio, if you see in the adult, it is mainly the females, they are more, but currently in India it is in the favor of males. But very soon, the way it is increasing, very soon probably we will face the same trend as we see in other countries, with the more number of females dominating this age group. If we see people above 60 years, like in different age group, they have different issues. Those above 60 years, many of them, they suffer with the impaired physical mobility, and 10% are hospitalized at given point of time in different countries. So meaning thereby that besides other issues, there is a big issue of physical mobility, so that restrict their access to healthcare services. Because नहीं मैं चेंज कर ले रहा हूँ हो रही है हाँ. So what I was talking about, yeah, regarding physical mobility, yes. So if they have reduced physical activity, then it would be difficult or it would impair their full access to hospital services or healthcare services. If we see age more than 70 years, more than 50% population, they suffer from one or more chronic conditions like chronic heart disease, cancer, hypertension, diabetes, or so on. And if we talk in context of India, it is really different in the sense that we get diabetes, hypertension, cardiac disease at an early age. So lot of population in 40s and 50s, they are getting these diseases, and they will, when they enter into the geriatric age group, they will already would have these chronic morbidities, and many of them might have the long term sequelae or complications of these chronic morbidities, which would lead to huge burden on our healthcare system. So what are the changes which occur into the when a person ages, right, with aging? So if any one of you want to tell what are the changes before I proceed? I don't know whether I can hear you or not. I can't. So, okay, let me then continue with. So, if you see in the first, start with the neurovascular system. What happens? Degeneration of neurons. So, also there is decrease in brain size and weight, which decreases sensory perception, declines, and then sensory perceptions also declines. Decrease in hypothalamic function. Then there is a cognitive impairment, changes in the memory, changes in the pain perception. So all these things lead to different kind of problems. Many of these things may lead to irritability, loss of memory, affect their health seeking behavior. If you talk about the respiratory system, there is a decreased elastic recoil with alveoli collapse, decreased response to hypoxia and hypercapnia, then increased prevalence of disease and infections. Many of them they have chronic bronchitis by this age because if they smoke or are exposed to pollution, or might be because of uh, other uh, occupational regions, they might have increased exposure to pathogens which might affect their respiratory system. Then renal system the same way, it affects kidneys, and maybe because of UTIs, repeated infections, or because of the drugs they are taking, different pharmacological agents, because of different ailments they might have, or because of chronic morbidity like hypertension or kidney disease or diabetes, their renal system might be affected. Cardiovascular system is other system which is very important, and many of them they might have ischemic heart disease or other cardiac issues, maybe disturbances in the rhythm of the the heart or rate, or issues in the sinus, and there might be thickening of wall, cardiac hypertrophy. So many of these things might happen. So basically, it affects all the system. If you talk about the eyes, uh, they have diminished vision. They might have cataract. They might have other issues. They might have issues in eyes related with the chronic morbidity like diabetes or hypertension. Then they have musculoskeletal issues. They have joint problems. They might have osteoarthritis, other kind of arthritis. Besides that, there is a high prevalence of other degenerative disorders, the high prevalence of cancers, and they might have, beside this, immunity related issues. They have issues with the nutrition because uh, quite often in the early age they don't take good care of their nutrition. They may be undernourished or malnourished. They may have micronutrient deficiency. They might have anemia. So these are all issues which are there in geriatric age population. So basically, almost all the systems they get affected during geriatric age group. So this is again the same thing which I was discussing, that what are the issues. So diminished sensorium that allows pathology to advance to dangerous point prior to symptoms. So that is again because when you are young, if there's something wrong, that something wrong is going on, you go and seek the medical care, and disease can be stopped at the early stage. But in the older age, they don't recognize it as a disease, or they don't perceive, or then they don't feel it, and often it delays the treatment, and by that time disease leads to dangerous situation. Then because of decreased immunity, they may have underlying conditions which may again pose a problem. Then I have uh, other issues which we have discussed, and many of them they take treatment. So polypharmacy, lot of drugs they take, and these polypharmacy may lead to, other issues because of the drug interaction. So the treatment which we prescribe should be, we should be very careful when giving drugs or treatment to these individuals, so that we can provide them optimum care with minimum side effect or unwanted effect of these medicines. Some other issues, false, they are very common. Many people, I mean, if you go and discuss with these people and elderly, uh, they fall down because of instability or because of their musculoskeletal system, and that leads to different issues. They might have injuries somewhere in the body. It may lead to fracture. It may lead to, injuries in the nervous system. They may have, you know hemorrhage in the cranium, and that might lead to altered sensorium and other thing. One important problem which is also seen in many Western countries and also now in India is about the elder abuse and neglect. You might have seen that sometime you'll see the news like somebody has left their parents or their elder, you know, family member, and deserted them somewhere in the temple or in the road or in the hospital, or sometime they get abused, or they get abused in the family. So that is again issue, and in many countries it is a legal binding on doctor that if they suspect any elder abuse, they have to inform the law enforcement agencies along with the treatment. So that is another thing in India right now. There is no clear-cut rule on this, but yes, elder abuse and neglect. If you suspect that there is something wrong, you should also inform the law enforcement agencies. They have psychiatric concerns. Many people, they feel loneliness because they are living alone. There's nobody to take care, or family members, they are busy living in other cities. So those are the emotional issues leading to, different problems and decreased health seeking behavior, and ultimately leading to more complications of the disease or comorbid conditions. I have already discussed about different organ system, neurological issues and cardiovascular issues, pulmonary issues which they might have, endocrine issues. Then females, there is a increased, chances of cancers, especially the urogenital cancer, cervical cancer, breast cancer. In males it is more of prostate cancer. Then there are many other gynecological issues. They may have prolapse and other issues with the geriatric age. So then there might be issues with the senses. I mean, they might have the hearing loss. They might have, poor vision because of underlying pathology. And all these things, they lead to frustration and, increases irritability. So these people many times will feel irritable because of decreased senses, and this worsens their situation because of irritability and depression. They may not go and seek their treatment. They also have a lot of psychological issues which can be dealt with the good psychologist or psychiatrist. So now coming to next slide, and here now we have discussed that what are the different health issues, what are the issues which geriatric population face. Now the question is, okay, it's an adult population, but why we want to provide them special care? Why they do need? They can be treated like adult. Yes, you are right. They can be treated like adult, but there's something special because of which they require special care, which is different from normal adult care. These people, they have reduced body functionalities. They have reduced economic output. Their paying capacity often is not good. They have reduced emotional resilience and emotional support, which I was talking about. Many times they are alone. Nobody is there to take care of them. They don't have enough energy to take care of themselves. They don't have means. They may not have money to support themselves or take or seek health care, or if they have consulted some doctor, they may not have money to buy the medicines, right? So then they have more vulnerable to get disease because of the poor nutrition, poor immunity, poor musculoskeletal system. Many of them, they are debilitated condition already due to pre-existing chronic health disease, like diabetes. I have talked about hypertension, cardiovascular disease, because in our country these diseases, they are getting uh, people getting affected at an early age, maybe 40s or 50s, and many of them, they have this disease when they become old, and they have some uh, complications because of these conditions. And management modalities, many times they are different. They require different kind of care, where you might need, different beds so that do not fall, or they might have different kind of, arrangements in the home so that do not fall, do not fracture themselves, do not come up with other issues. So their health issues, they are multifaceted. When a geriatric person comes, he may not have only one single issue. I mean, they suppose if somebody is coming with the diminished vision, so it may not be just diminished vision because of the cataract, right? You will have to say in the holistic way, in totality. He might have diabetes, he might have hypertension. Because of that, the vision is decreased. Then okay, vision is decreased, you found that okay, person is suffering from diabetes. Okay, then by the time they are there, they might have uh, issues with the kidney, might have issues with the neurological system or cardiac system. So they have many issues when they come. And what happens that our health system is already overburdened because of huge population, and we are 1.3 billion population, so there's a huge number of people. And if you see, we don't have that much doctors available as per the western standards. So when people, they give priority to other age group, because in this age group many people, they are not in condition to pay. And in the private sector, everything is working on on mainly on financial things. Who can pay better, they will provide treatment to them. So that is against system. So they are many times they are ignored. And as I have discussed in very beginning, that the young population, which is now the form the majority of constitute the majority of Indian population, they would start graying in maybe next 20 years or 30 years. And by that time, we will have a huge population in geriatric age group, and they will require big care for their services. So what are the government initiative? It's not that government doesn't know, or government has not thought about all these issues. They have been thinking about it, and there was a policy on older persons which was formulated in 1999. And then there was a working group uh, which this which gave recommendations for a national program for elderly. Then there was a Act on Maintenance and Welfare of Parents and Senior Citizen Act 2007. Then 2008 and 9, there was announcement of National Program for Healthcare of Elderly during budget speech. And ultimately, Government of India has launched National Program for Healthcare of Elderly by Ministry of Finance in 2010. That was approved by Ministry of Finance, and now it has been launched all over the country, and which I would be discussing in subsequent slides. So, as I was discussing national policy on older person, what was that? So, what they have suggested, what was the agenda for the national policy? Geriatric ward for elderly at all district hospitals, then treatment facility for chronic terminal and degenerative diseases, providing improved medical facilities at community health center, primary health centers. There was a provision of mobile clinics, inclusion of geriatric care in the syllabus of medical courses, including courses for nurses, reservation of beds for elderly in public hospitals, then training of geriatric care givers, and to have research institute for chronic elderly diseases such as dementia and Alzheimer's. This was envisaged in NPOP agenda. And I was discussing about the welfare of parents. So the state Government shall ensure the government hospital or government funded hospitals shall provide beds for senior citizens as far as possible. Then separate queues to be arranged for senior citizens. Facility for treatment of chronic terminal degenerative disease is expanded for senior citizens. Research activities for chronic elderly disease and aging is expanded. Earmark facility for geriatric patient in every district hospital. So meaning thereby that government wanted to facilitate as much as possible, and you see that in almost everywhere in all the hospitals there is a separate queue for geriatric population. Now many hospitals and many departments they have or medical colleges they have different facility or department or unit for geriatric care, and government is trying to build one such unit in every district hospital. Then I was talking about the national program for healthcare of the elderly, which was approved in 2010. So it was as per the UN Convention on the Rights of Persons with Disabilities, and also based on national policy on older persons, which I was discussing just now, that what are the issues which government has envisaged in the NPOP. So they have been included. And section 20 of the Maintenance and Welfare of Parents and Senior Citizen Act on dealing with the provision of medical care of senior citizens. So all these things have been incorporated in this program, and it was approved in 2010, and mainly recommendations are from the National Policy on Older Persons, which was framed in 1999. They were included along with some other like Maintenance and Welfare of Parents and Senior Citizen Act 2007. So what is the vision and objective of this national program, which is called National Program for Healthcare of Elderly? What is the vision? So vision is, let me read it out, to provide accessible, affordable and high quality long-term, comprehensive and dedicated care services to an aging population. So basically they talk about the quality long-term care, comprehensive, which includes everything because they have many problems, right, and dedicated. So there should be a dedicated service, meaning they have a dedicated ward or dedicated department or dedicated center for this purpose. Creating a new architecture for aging to build a framework to create an enabling environment for a society for all ages to promote the concept of active and healthy aging. Now, we have increased, you know, the life expectancy, लेकिन सबसे जरूरी चीज है, what is the most important is that it should be a healthy aging. We want people with the increased life expectancy, they should be healthy so that they can lead happy life. You know what is health? Health is wealth, people say often. If at the old age they don't have good health, how would they enjoy their life? So there should be something we would be doing to promote that they go into active and healthy aging, where they are less dependent on others, they can do their things independently, they maintain good health and live happily. So that is the concept. Enabling environment for all society, meaning thereby that we live in a society where there are children, where there are adults, where there are males, there are females, there are old people, there are debilitated people, disabled people. So there should be environment that nobody should feel that okay, because of their age they cannot access something like under certain act. You must have seen that now in all the hospitals and most of the public places they have the ramp for the people who are on wheelchair or who cannot take their stairs. There are separate lifts for them people. So all those kind of environment we have to create to make people live better in different age groups. What are the objectives of Npcse, that is National Program for Healthcare of Elderly? To provide an easy access to promotional, preventive, curative and rehabilitative services through community-based primary healthcare approach. What is promotional, preventive, curative and rehabilitative? What is promotional? Promotional is basically we have to have the health services which promote good health, like We have to create environment where, say, more parks, play space where they can walk. It promote good health, right? Good eating habit, the environment where they can get the nutritious diet to promote the health. What are the preventive? Preventive is that take the appropriate measures so they don't get sick, where we can give the vaccines, say for pneumococcal pneumonia. There's vaccine available, so we should vaccinate them. Vaccine for the flu to prevent these illnesses so that they live the healthy life. So that is a preventive. What is a curative? Suppose if they get the disease, they get early treatment so that we can cure the disease and it does not lead to a stage where they have to suffer a lot. Suppose if they are having ischemic heart disease, they should be treated in a hospital, either with a drug or if required with the surgical maneuvers or a stent or whatsoever the best way so that they can lead the good quality life. Few people might require rehabilitative services. Suppose somebody loses their limb because of diabetic gangrene, then there should be some issues, some facility for rehabilitation, or there's some issues with the eyes or hearing, then we should have the appropriate services to rehabilitate. How to deal with these people, provide them adequate treatment and rehabilitate services. So that is the objective. Then to identify health problems in the elderly and provide appropriate health interventions in the community with a strong referral backup. Again, a strong referral backup is important. Suppose a person visits primary health care center and most of the time everything cannot be treated at the PSC. They have their limitations. Maybe 60-70% diseases can be treated at the primary healthcare centers, but then they require certain percentages secondary care level facilities and maybe less than 10% maybe tertiary care centers. Though in geriatric group, the secondary and tertiary care center services may be little more because of their multiple health issues. So there should be appropriate referral system and timely referral system that if there's something, if they can be treated at the PSC, it's good. Otherwise, they should be referred to appropriate center where they can get good care. And there should be some kind of community support as well. Many places with the Panchayati Raj institutions, it has been established. Other organizations, they are also working in this area. Then to build capacity of medical and paramedical professional as well as the caretakers within the family for providing healthcare of the senior citizens. So it is very important that the healthcare if we can provide them services within the family, because most of the time they live with the family. Family members should know what are the specific need, how to provide them services, how to get the time and the proper diet and the medicines well within time. Then we have to have the paramedics and medical people who are well trained, who know how to provide special care to this population. That's why now geriatric lectures, they have been included into curriculum so that people they are aware about their issues, problems, and better understanding to take care of this population. To provide referral services to the elderly patient through district hospital, regional medical institutions, and convergence with the National Rural Health Mission, AYUSH, and the other departments like Ministry of Social Justice empower them, because it's not only the health. Many times they might, I don't, this is fourth semester, so you, because of COVID, you might have missed this posting, which we have through community medicine department in the field practice area. Is during fourth semester you go to urban centers, and the seventh semester it is in the rural center at one level. Here you get this comprehensive idea. What does this mean? That many times when you go to the family, they may have issues with their pension, their money. So if you say, okay, take good food or take treatment, they don't know where to go. They do not have money. Many of them, they do not know that they are programmed by the government where they can get old age pension or other benefits. So it is very important that not only the medical treatment, not only the healthcare services, you have to further complete, because health state complete mental, physical, and social well-being. So what you are talking here about is that if they are sick and or they are in a poor health condition, not have money, then it is also your responsibility, also healthcare system responsibility to help them or connect them with a system from where they can get help in the area of nutrition, in the area of this thing, the empowerment, whether it is in the form of finances or otherwise. So there are many organizations which are working in this area, and that is an important aspect. So what are the strategies? विजन देख लिया, ऑब्जेक्टिव देख लिया, तो कैसे, हाउ टू अचीव दिस, क्या स्ट्रेटजीज हैं, गवर्नमेंट ने क्या सोचा इसके लिए? तो कम्युनिटी बेस्ड पीएससी अप्रोच इंक्लूडिंग डोमेस्टिक विजिट्स बाय हेल्थ वर्कर्स. If you see the healthcare system in India is basically three-tier system: primary healthcare, secondary healthcare, and tertiary healthcare. AIIMS is a tertiary healthcare system. Hospital. It has a one secondary health hospital in Ballagar. Most other district hospitals are secondary care hospitals. Community CSCs, they are mainly somewhere between primary and secondary care, and PSCs, they provide the primary health care. All the PSCs, they do have sub-centers, and these sub-centers run by the health worker. So these health workers are supposed to do domiciliary visit. So that's what we are saying, that community-based PSC approach, including domiciliary visit. So these health workers should go and visit and find out where the elder people living, what are the issues, and connect them with the health system as and when required for early diagnosis and treatment and care. Dedicated services at PSC, CSC, including provision of machinery, equipment, training, additional human resources, information, education, communication, etc. Many these old age people, they require different equipments in the term of like stick to walk, walking aids, or hearing aids, or glasses for better vision. So there should be some provision to make these things available to them through PSC, because predominantly we live 65% to 70% India still live in the rural areas. PSCs, they are mainly in the rural areas. So we want them to get most of the services at the PSC level, near to their home. For this, equipment and machinery should be provided at PSC CSC level, and the manpower should be well trained so that they can provide them IC activity, those who require it. If these people, they have some health issues which cannot be treated at the PSC, then there should be dedicated facilities at the district hospital. Each and every district in India have a hospital, and government under this program has envisaged that there should be 10 bedded ward for elderly, so that those who require special care can be referred to this place. Beside that, 8 regional medical institutes to provide dedicated tertiary level medical facilities for the elderly. Government has planned to make 8 regional medical institutions where there are big centers dedicated to geriatric care at the tertiary level, where all the facilities which are available and those who require referral from district hospital to these facilities, they can be referred and can get treated. Then introduction of PG courses. Recently, PG course has been started into geriatric medicine. Our institute has a different department for the geriatric medicine. Long back, it was part of medicine department. When I joined this institute, it was only internal medicine, but now for geriatric population, it is a separate department, and they have even the PG courses for geriatric medicine, and they are in process of making a geriatric center, tertiary care hospital for geriatric population. Then IC activities using media and other communication channels. For any program, it is important to have continuous monitoring and evaluations of the program. So that is in research, promotion of public-private partnership in geriatric healthcare. There are many good things in Ayush, and we should make use of them. And that's what government have envisaged under Npcse, that mainstreaming Ayush What is Ayush? It is Ayurveda, Yoga, Unani, Siddha, Homeopathy. So these are the alternative system of medicine, and many of their treatment they have good health benefit. So they should be used as per the need and as per the local traditions, because some systems are popular in some areas of the country, other system in other areas of the country, and they should be utilized to its maximum, because many people they have more faith in the traditional medicine rather than modern medicine. So all the useful practices should be utilized for the better care of elderly. And in the last but not the least, I think one of the most important issue here is the reorienting medical education to support geriatric issue, because as I said in the beginning, long back, it was not there to discuss geriatric issues in a separate lecture or have emphasis. When I was doing my MBBS, the main emphasis only on the infant care, child care, and mother care, ANC care. Nobody was talking about the geriatric care. It was a neglected lot at that time. But now there is more emphasis, and when we orient our doctors, our budding doctors, medical students, paramedics regarding geriatric population, we orient them uh, when they know why it is important to provide them care and how it is different from other care, then they would be able to provide better care wherever they serve after doing care. So these are the different strategies which I have already discussed, whether it is PSC based, CSC based, or district hospital, or regional medical centers, or PG courses, or IC activities, or domiciliary visit. These things have already been discussed. So these are the main strategies for national program for healthcare of elderly. If you understand all these things, I think for your level, this is more than enough. But because time is there, so I'll go through a few more slides to make you understand it better. These are the supplementary strategies for Npsc, promotion of public-private partnership in geriatric healthcare, mainstreaming of Ayush, and reorienting medical education. All the points have been discussed. What are the major components? 8 regional centers, dedicated healthcare centers in 100 districts first, because we said that in each district hospital there should be 10 beds. So in the first phase, it is implemented in 100 districts in 21 states. To have the geriatric unit at district hospital, rehabilitation unit, CSCs, weekly geriatric clinic at PSCs, and provision of supportive devices, equipment, etc. Package of services at different levels, that is sub-center, primary health center, community health center, regional geriatric center. Institutional framework for implementation of integration with NRHM, which is now NHM, National Health Mission, then State Health Society, District Health Society. So what are the services which would include health promotion? To have good health, I have discussed the promoting activity in the beginning. Then preventive services, I have given you example like vaccines, diagnosis and management of geriatric medical problems, both outdoor and indoor patients. Then daycare services, rehabilitative services, and home-based care, mainly through the health workers. Plan is to link the district with the regional geriatric center for providing tertiary care, and integration with the existing primary healthcare delivery system in the country, and vertical at the district and above as more specialized healthcare are needed for the elders. So this is the organization structure, how to implement it, and it has been now coordinated with NCD cell, which is for non-communicable disease, because a lot of people in this age group they have non-communicable disease as well. So this is the program structure, this is the organizational structure, how it is envisaged to organize all these activities from sub-center to tertiary level center. Water services sub-center, health education related to healthy aging, domiciliary visits to home-owned bed-ridden elderly patient, arrange for suitable calipers and supportive devices, linkage with other support groups and daycare service centers. At PSC, weekly geriatric clinics by trained medical officer conducting a routine health assessment, provision of medicines and proper advice on chronic ailments, public awareness on promotional, preventive and rehabilitative aspect of geriatrics, health and village sanitation camps, referral services, geriatric clinic for regular dedicated OPD services to the elderly. This is at the district hospital. Then 10-bedded geriatric ward with existing specialties, providing services to referral by CSC, PSC. So whomsoever come from the CSC or PSC, they should be provided services here. And then if required, they should be referred to regional center. And regional centers would be the the main center, tertiary centers with the all the specialized care, OPDs, and tertiary health services. So these are the places where regional geriatric centers are being made, and these are the different states which would be linked with these centers. One such center would be at AIIMS, New Delhi. So these are the services which I have already discussed at different level, what services should be given. There should be also provision for emergency health services, which has been started in certain areas. This I will not discuss with you because critical appraisal, I don't think it is needed at this stage for you people, but yes, you should know what is the national program. Modern technology is also being used to provide healthcare services in certain countries through unmanned aerial vehicles like in China, Internet of Things, etc. So now everywhere we are using IT. Even this lecture we are delivering and I'm connecting with you all is through IT. So IT has an important role to play in all the services and geriatric care as well. And with this, thank you very much. And I don't think I can communicate because I don't see here any speaker or anything in this LT. So maybe if there are questions, whenever you can send through email, or whenever you are here, you can visit department and you can discuss. So both this way we can work out. I have taken attendance in the beginning. Those who were there in the beginning at 9:10 a.m. they have been marked present. Thank you very much for your listening. Thank you.